Hello, everyone. I'm Sherry with the CGH Health Foundation, and welcome to our October Growing Healthier program. This series is meant to educate you and inform you, and it gives us a chance to introduce you to some of our providers as well. Our programs are always hosted by Dr. Bill Bird, our medical director at CGH. In today's program, Dr. Bird is going to be talking to Jolie Parks-Gruen, and Jolie is our informatics director, and informatics means all of that information, our patients' records and charts and the information's there. And that's a big job in and of itself, but CGH is transitioning to a new medical record or electronic medical record, and so Jolie's going to be talking about that today. At the CGH Health Foundation, we had a very busy month, and we wanted to send a thank you to everyone that helped us, whether you donated to our auction or you went to one of your schools for their pink night, or maybe you bought a pizza from Angelo's, everything that you did to support us this month. And it allows us to provide free mammograms to women in the Sauk Valley area, plus our dementia services, our pediatric mental health services. So again, just thank you for everyone who contributed and supported us this month. Before I turn it over to Dr. Bird, I want to tell you about next month's program, and that's just 2 weeks from today, Thursday, November 13th. And Dr. Bird's going to be talking to Dr. Marianne Kavanaugh, and Dr. Kavanaugh's specialty is orthopedics and orthopedic surgery, and she's going to be talking about your feet and how to keep them healthy and what to expect if you have to have some kind of foot or ankle surgery. So now that you know what's been happening and what's coming up, it's time to get today's program underway. And Dr. Bird's waiting out there in the wings. Are you ready, Dr. Bird?
Oh, of course. Hi, Sherry.
Hello.
How you doing?
Oh, you got applause.
What's that?
Rebecca has a new sound effect that she's playing with. You got applause.
Oh, really? Was that? I thought it was just like static. Okay. All right. I'll know next time. Hey, one little tweak on what you said about Dr. Kavanaugh. She's actually podiatry.
Oh, I'm sorry.
That's all right.
Yeah, sorry about that.
Point. She does work on people's ankles and feet. So
okay.
We'll talk more about that in a couple of weeks. So
okay.
All right. So yeah, today's an exciting day around the hospital because we are really close to going live with a new electronic medical record. And that has taken a lot of energy from a lot of people here at CGH to get to the point where we're going to be at this Sunday morning at 3 a.m. And I have our project manager, the person who's the director who is overseeing this whole implementation, on our call today to talk about it. Let's get Jolie here on the call. Hi, Jolie.
Hello.
How are you today?
I'm doing well. How are you?
Well, full disclosure, Jolie and I have already talked a couple times today. That's the nature of this Go Live. So Jolie, I'm going to ask you a few questions about our Go Live, and I know you'll be able to knock these out and help folks understand what's going to be happening, and also how this new electronic medical record platform is going to be helpful for patients. So Let's start with that. First question, this platform that we're going to for electronic medical record is called Epic. What exactly is Epic, Jolie?
Yeah. So Epic is actually an electronic health record, or you might hear it referred to as an EHR system. And with that, it actually stores patients' medical information, things like their allergies, their medical history, their immunizations, test results. And it's actually used by our clinical staff to document any clinical information, like any orders that might need to be done, or any tests, any notes about progress with a patient or related to their office visits. It's actually also a comprehensive system, so we are going to use it for scheduling as well as retaining insurance information, keep track of billing, and allow patients to make payments on their accounts.
Yeah, okay. Epic is a big company, right? Tell us about that, Jolie.
Yeah, Epic is a very big company. They're headquartered in Verona, Wisconsin. They have, I don't know, probably 14,000 employees at this point in time. They have hospitals that use Epic across the United States, and they're actually worldwide as well. So there are hospitals and clinics in other countries that are using Epic too. But it is a really cool place up there in Wisconsin that maybe some from the area that have been up that way towards Madison have driven by.
I've been there, and they have great artwork, and you actually can do a self-guided tour and walk through all the different buildings and see the artwork. So if you're ever having a, like a day where it's winter and not much else is going on, check it out.
Yes, and they have indoor walking paths and underground parking. So if you do go in the winter, you don't have to be walking outside in the snow.
So it's actually a destination, even if you're not into EHR. So
yeah.
One other thing I just wanted to mention is we're very fortunate to have Jolie in that she actually worked at Epic for, what was it, Jolie?
8 years.
8 years. And guess what she did? What did you do, Jolie?
I implemented Epic at hospitals and other healthcare organizations across the U.S.
So we feel very fortunate that Jolie is here with us during this implementation because it's not her first rodeo. And she's from the area. Are you from the Milledgeville? Is that right?
Yeah, so I'm originally from the Milledgeville area. I grew up there and went to school there.
Okay, and it seems like maybe some dirt farming pulled you back in here.
Maybe so. Yeah, my husband is also from the area, so I moved back in 2024.
Okay, well, glad to have you. Let's go back into just some advantages. And I want to talk about, first of all, what are some of the advantages for both patients as well as CGH staff when we convert to Epic, Jolie?
Yeah, so I think from a staff perspective, one of the biggest advantages that staff is going to see is right now we have a system that we use on the outpatient clinic side of our operation. And then we have a separate system that we use for our hospital and ED systems. And so with Epic, we're actually getting one single integrated platform that's going to house the medical records and medical information for our patients, no matter which care setting they're seen in, whether that's on the clinic side or the hospital side or the ED. So for staff, all that information is going to be stored in one place. It's going to be more easily accessible than it is even today. And it really, helps our staff see the whole picture of a patient when they come in seeking care from us. I think another big thing our staff is going to be able to take advantage of is the interoperability of the system, which means if our, patients are seen at other healthcare organizations, we can actually, or have been seen at other organizations in the past, we can actually pull their record information into our system to once again give a more complete picture of that patient's history so that we can make the best treatment options and decisions for those patients.
Yeah, I mean, we've talked about it, but it's so nice. For patients, just so you get a sense of this, and when you had two different systems, if a patient, if you were seen by a doctor in an office and then you came to our emergency room, the medication list, we had to go look into the other system to try to find it. And it was always tough to kind of get those all synced up. So the fact that medications and any problems that you might have had in one place didn't go to the other place made it much more difficult for staff. And also just, at times it was, you had to make sure you had everything in place to make sure you had the right information for patients. So this will be really nice. And then just to piggyback on what Jolie said about other facilities, so particularly other facilities that are Epic facilities, which most of the bigger medical centers around us, Northwestern, UW-Madison, University of Iowa, are all Epic shops. So if you saw a doctor at UW-Madison, we'll be able to pull up the record from what happened when you saw that doctor at UW-Madison right then and there, and not have to call and have something faxed to our offices so we can find out what really happened. We'll have it right in front of us. So I think for our staff and for sure for our patients, that's going to be very helpful in terms of their care.
Yeah, absolutely. I think, with a system like Epic that's so used across the country and whatnot at these larger organizations as well, there's a lot of new tools and technology that we're going to get with this new system as well, to continue to gain efficiency um, with our operations and like provide that better patient care too.
Yeah, AI, obviously that's a big buzzword these days, but there's going to be some AI embedded within Epic when we go live. Just so folks have a sense of that, what are some things that AI is going to help our staff with to take care of patients?
Yeah, some of you who may have been seen more recently at CGH may have already experienced a little taste of some of that. We can actually use AI
Jolie's a
technology.
little bit breaking up there. You're break. 1 second, Jolie. Would you start that again? You're kind of breaking up, and you're on my screen at least. You're still. So just kind of maybe rattle around your mouse and see what happens.
All right, can you hear me now?
Let's give it a go. Yeah, there you go. You're looking. I'm seeing you. You're moving. Oh, they're saying that we're both breaking up a little. Okay. Well, let's do our best.
We'll do our best. I was just saying that with AI, we're automating some processes that maybe we were having to do manually today. I think some of the technology with AI that we'll be able to take advantage of is summarizing information. When you've been in the office, maybe recently at CGH, some providers are taking advantage of some ambient technology that you can talk through talk with the patient about their issues and the treatment plan, and the AI technology can kind of help us summarize the note information, making it more efficient for our clinicians.
Yeah. One of the things that our medical staff are pretty excited about is a lot of them are going to be using, did you mention DAX?
Yeah, DEX.
Yeah.
Yep, that's the name of it.
Yeah. So expect there's a good chance that when you see a doctor for a visit, they may ask you if it's okay if they can use their phone to use this software, which essentially takes the conversation that you and the physician have and puts that into a note format. So for the doctor, they can be looking at you instead of at the computer doing that process, because the note's already being generated, all the information's being generated while you talk, which is, I think, really helpful for patients, because as you all know, that it's not uncommon for the computer to be part of the visit, or more part of the visit than we would like, both for the doctors and for the patients. So as we have this new voice recognition technology, the ability just to talk with a patient and have that note generate, and the doc can then look at the note and edit it, and then make any edits that need to be done, and then there they go, and they're off to the races. So I think that's going to be a win-win for both patients as well as for our medical staff.
Yeah, absolutely. You mentioned benefits for patients.
Yeah.
And I didn't touch on that yet, but I think the biggest benefit for our patients is you're going to have a new, really easy to use patient portal. So similar to how I mentioned that with Epic as our new electronic health record, will allow us to have that one single chart for that patient record, whether they're seeing it no matter what care setting. The MyChart portal, that's the name of our new portal, it will do the same. So all of your information that you can access through the portal, whether you were seen at the hospital or the clinic or the ED, all that information lives in one portal now, rather than having separate portals for the clinic or the hospital setting.
Yeah, and that's going to be pretty cool.
Yes, absolutely.
I'm going to have you in just a moment here kind of give us some more information about how to get signed up and those type of things with MyChart. But before we do that, one other patient thing that I think is going to be very nice. Can you talk about the billing process and how that's going to change?
Yeah, I sure can. So with the new system, going forward, your appointments will be billed out of our new system, and you'll be actually able to go into your MyChart account, make payments on there. You can set up auto pay if you'd like to do that. Making a payment online through the MyChart app or through the website is very simple. It's very easy. So any of your visits going forward will be billed through our new system, and you'll be able to see those balances or make those payments through the MyChart app.
And you'll just have one bill.
And just one bill. Yes.
For those who are familiar with our hospital, because we've had two separate systems, we've had two separate bills, which I know has been something that folks have given us feedback on for a long time. They would prefer not to have two different bills. And so that, as we go into this new platform, if you have some bills from the previous one, then of course you'll be working with those for a little bit. But after anything done new after the date of our launch will be that one bill system.
Yes, so, and you called that out, but yeah, if there are any balances from visits that were prior to November 2nd, patients might still get a bill for that, and then a separate bill for their new services. But any of your services that take place November 2nd and beyond will be on one bill.
Yeah, great. So I want you to kind of go through MyChart in terms of perhaps maybe do you have a demo or what that looks like, and also how people get signed up and everything with MyChart?
Yeah, so let me tell you a little bit about how we can get patients signed up. On the screen right now, you can see is our webpage, which you can go to cghmc.com/MyChart. And from there, you can click, there's actually a link right on our homepage that'll take you to the sign up. So that is one way. On our homepage, it also tells you a lot of information about what the MyChart app can do, and information about what changes are going to be coming or how that transition will look like. So there's a nice FAQ section on the website that'll explain that. Once you go to the link to sign up for MyChart, that you can also go to actually the mychart.org website as well to sign up. And when you do that, you'll go to the Access MyChart link, and then you'll have to actually search for our CGH Medical Center version of the MyChart. So if you're a MyChart user today, one thing to keep in mind is just because you use it today with another organization doesn't mean you're good to go. You still need to add our organization to your MyChart account or to your MyChart app. And so that's where on the website or on the app, it will ask you to search for your organization that you want to add, which would be CGH Medical Center. And I did mention the app as well. There's a way that you can sign up you can download the app from the App Store, and then search for the organization from there. You can get it on an Android or you can get it on an iPhone, so it is available in both of those settings. Once you click the sign up and choose the organization, it will, there's a process for verifying your identity. So you will receive an activation code. So you can't just click sign up and be ready to go. There is a little bit of a process to get it fully activated. I know some of our patients who have already initiated the sign up process maybe got an activation code sent, but haven't quite actually activated their account yet. There's also a third party that we're using to help verify your identity if you do choose to sign up online versus coming in to do that sign up. So you might get asked a few questions that will help us verify that you are who you are. And then we do set up two-factor authentication for MyChart as well. So it'll ask you for your phone number and your email as alternate ways to do that two-step verification, similar to a lot of other apps that people might use today. You'll choose a username and password. There is a new functionality that's actually coming out. So if you've used MyChart before, you might have a couple of different usernames for different organizations that you've used it for in the past. But with our implementation of MyChart, just happens to be conveniently coming at the same time, MyChart Central will be available, which will allow you to actually combine your MyChart accounts. And so you can use just one single username and one password, whether you're accessing the CGH MyChart or one that you've had previously. But for now, if you're a new user, you'll indicate what username and password you want to use.
Jolie, when they do that, when they enter the username and password, if they have a username and password for, let's say, UW-Madison, will they have to choose a different username and password to get access to this new system where they can access all the different MyCharts within that app?
So I believe they will have to choose a new one unless they are going under the MyChart Central. Once you're in the MyChart Central, for other organizations, they have to also have that feature on. So it is dependent that other organizations have turned that new functionality on. So you may have to have a separate username and password. It really doesn't necessarily have to be any different. You might choose to use the same username and password, but there are potentially some different password requirements based on the organization. What they require to be like those special characters or numbers.
Sounds good. What else?
Once you've chosen your username and password, you do have to accept our terms and conditions of use. So that is a part of getting access. And one other thing about the usernames and passwords I should mention, if you are currently a user of the My Access portal that we have today, those usernames and passwords don't transfer over to MyChart, so you will have to start with a new username and password.
Sounds good. Jolie, are there any, let's say someone goes through this process and they still have a few questions, is there a phone number that they can call?
Yes, actually. So we do have a MyChart help desk that's available to our patients. The number is on screen there below, but it's 815-564-4004. You can call that during normal business hours to get assistance with anything you need with the MyChart app. I believe we actually also have somebody sitting in our lobby right now who is helping answer questions for MyChart or helping patients get signed up. So you're welcome to stop in to the main clinic lobby if you'd like some help setting that up.
That's good. And if you want to get any baseball tips, you can get those too when you get signed up. It sounds like this young man who's helping us out is he a minor league player or something like that?
Something like that. That's what I've heard. Yeah.
All right. Good. So a lot of ways to get yourself signed up for MyChart. Really encourage folks to do that. I think it's going to be really a nice feature for patients to be able to have their information. And I forgot one other thing I was going to ask you, Jolie. So talk just briefly about how that works in terms of allowing other folks to have access to your information too.
Yeah. So one of the features of our MyChart application is you can get proxy access for someone, or you can designate someone else to be a proxy for you, which means, for maybe our parents that have children that are, under a certain age, they might want proxy access so that they can see their medical record, in the same spot that they also see their own medical record, and have access to schedule those appointments for their kids. Same could be true if you're a caregiver, or you have a family member that you want to designate proxy access to. They can use the MyChart application to see your medical record as long as you've designated them as a proxy. We do have some requirements about proxy access and making sure that especially if the patient is over a certain age, that they give you access. So that's something you can talk to our MyChart help desk about if you want to get proxy access for someone.
Before, people had to come into the clinic to get all set up for that. And now, once we get this going, you'll be able to do that without having to come in, is my understanding. Is that right, Jolie?
Yeah, I think the easiest way to do that without having to come in would be to, if the person designating proxy access can go and grant someone that themselves. We also have the ability to grant others proxy access, but we would need confirmation from the patient in those situations.
Okay, very good. So when is this big go live date, Jolie?
The big day is this Sunday at 3 a.m. So we've got some teams starting to transition over some of the last bits of information on Saturday, and they'll work all through the night. And then we're hoping to flip the switch and start using Epic at 3 a.m. on Sunday.
We gave ourselves an extra hour with the fallback, right?
We did, yes. We're gaining an hour with the time change in there.
I see Michelle's question. Michelle, I thank you for asking that because I forgot to ask that. You want to talk about that, Jolie?
So Michelle's question, do you have to do proxy access if you are already signed up with the HIPAA access at the facilities? So I do think that some of the HIPAA forms that you've already filled out can be referenced to give proxy access, but we will also be starting new HIPAA forms at the end of the year.
Yeah, my understanding is, so Michelle, I think the current forms are, don't quote me on it, but I think they're good until the end of this year. Between now and then, though, you need to get the proxy set up through Epic, because after the beginning of the year, those current forms will no longer be valid after that date. I hope that helps. We give you a little grace period. What does Lois say?
Lois, the linking of those MyChart accounts, that MyChart Central, won't be available until after November 2nd. We do, you can actually, so just to clarify, you can sign up for MyChart now. It is live. You can go to our website and complete those sign up process. You can go to the app and sign up as well. But we do have a limited number of features that are available until the rest of our system goes live on November 2nd. And that MyChart Central is one of those where that will go live with the rest of our Epic go live on Sunday.
Yeah, good question. Well, while you were answering that, another thing that I thought for patients would be really nice. Talk about like scheduling appointments through MyChart.
Yes, we have a lot of features that are available in the MyChart. You can use MyChart on your phone or on the desktop. So for those of you who are used to having an app on your phone and ready to go, you can continue to do that. For those of you who maybe would prefer to see it on a larger screen like your desktop computer, you can access MyChart from there. But the features that we're going to have, I'm really excited about. Our patients are going to love it. I think, you know, if you've used it before, I haven't met anybody yet who didn't like it. But you can schedule your appointments through the MyChart app. You can see any upcoming appointments. You can cancel appointments if you need to, or reschedule all from MyChart. I already talked about you can make those payments. Something I really enjoy is you can see your test results. So if you have, you know, labs done or something, when those results come back, you're able to see where, you know, how they came back and what range you're in, and get any advice from your care team about what maybe you should do based on those results. You can initiate medication refills. So that's going to be a really easy process to do through MyChart. And, you know, message with your care team if you have questions maybe that you'd like some care team to weigh in on.
Just a clarification on the appointment scheduling. So for your primary care physician, you can schedule an appointment online.
Mm-hmm.
With our specialist right now, that's not going to be an option. You still have to go through the typical referral process for that.
That is true.
Just so we're clear on that.
Mm-hmm.
How many folks are signed up so far?
We're seeing the numbers grow every day since we've launched MyChart on October 20th. But I think right now we're around 3,000 patients have already signed up for MyChart. And there's probably another 1,500 that are in a pending state. So maybe they've got their activation code sent, but haven't quite fully activated the account yet.
That's nice. Can you take a look at Michelle's question and try to answer that one, Jolie?
Yes. So Michelle is asking about the current system and toggling between her record and her spouse's record within the MyChart application. Yes, there is a way to do that. That's that proxy access. I would recommend you call our help desk so they can walk you through exactly how to turn on that proxy access or grant that. But once you have been granted proxy access to your spouse, you'll be able to toggle.
Very good. Hey, one other thing before I let you go, Jolie, you're sitting in the epicenter, and our marketing team asked me just to have you kind of talk about what is down there at that epicenter, and it's downtown, right next to where Dr. Hahn and Dr. Cutter's vision office is there in downtown Sterling. But tell folks what you have down there.
Yeah. So the entire team from CGH that's been working on implementing this new system, we've been down here since fall of 2024, right where the old Blockbuster used to be. Our wonderful CGH POM team came down and renovated the building so that we had a space for the 40 some people that we have working on this implementation. So there's an office space down here on the Blockbuster, what was the Blockbuster end of the building. Then in the middle of the building, we still have, Dr. Cutter and Dr. Hahn's space as the vision center. And then actually at the other end of the building where there used to be an old medicine shop, we have a training center. So we have a number of stations set up where we've been hosting training for Epic classes. Part of this implementation of a new system is learning how to use the new functionality and how to navigate around. So we've sent our entire staff through training on Epic and how to use it. And one of the rooms we've been using to do that is located at the other end.
Okay. Yep. So a lot of folks in there doing a lot of good work.
Yes. Yep. And we'll be busy this coming week as we
yes.
go live with the new system.
Yes, we will. Well, I'm really excited about the chance we had to talk here, Jolie. And for the folks who are watching this or will watch this, I think you're going to find, first of all, I'm obviously very biased, but I think CGH does a great job of taking care of patients. Always has, always will. I do think that adding this new electronic medical record platform, Epic, is going to be a very nice feather in the cap in terms of our ability to do that, because we're going to be able to do some things that are going to be really helpful for patients and their families to help them with the care that they receive here. So I'm really excited about that. Jolie, thanks again for your time. Thank you for what you're doing. And you and I know that we'll be talking again today soon, won't we?
Soon. Yeah. Thanks for having me, Dr. Bird.
Thanks for watching. We appreciate it. From CGH, this is Bill Bird, Chief Medical Officer at CGH. Thanks for taking the time to watch. Oh, hey, before I let you go, I'm sorry, I have a couple things I wanted to show first. My bad. What do you have for us? Okay, so holiday open house at our auxiliary gift shop coming up soon, right in the middle of the launch. All right, healthy and bright. So we're going to have our lights as usual, and it costs money to put those lights up, and our auxiliary has been involved with that process. But if you'd be interested in being part of that, we would sure love to have you do that and hear some information about how to get more information. Want to celebrate our employees of the month. We're doing September. Peggy Carney in the Wound Center has been a nurse in the Wound Center and does great work. We're doing September because I think how we did our Facebook Live, we didn't get a chance to have Peggy on for our session before. And also Christina Everly. Christina works in the release of information department, which is in the main clinic, and does a lot of good work to help patients get their information. Okay, so as Sherry alluded to at the beginning of this broadcast, we're going to have, in a couple of weeks, I'm going to be talking with Marion Cavanaugh, who's a surgical podiatrist who's new here at CGH, and find out more about her and find out about the work that she does as a surgical podiatrist. Okay. Well, once again, thanks for watching. This is Bill Bird, Chief Medical Officer at CGH Medical Center in Sterling, Illinois. Bye.